Learning medicine is hard work. Osmosis makes it easy. It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today.
Coxsackievirus, sometimes referred to as Coxsackie's virus, is part of the enterovirus genus of the picornavirus family, named after Coxsackie Village in New York, the place where it was first isolated. Coxsackievirus is surrounded by an icosahedral capsid, which is a spherical protein shell made up of 20 equilateral triangular faces. Nonetheless, it's a naked virus because the capsid isn't covered by a lipid membrane. It's also a positive-sense single-strand virus. This means that its RNA is actually mRNA, and the host cell ribosomes use this mRNA to make one long polyprotein chain, which is then broken into smaller pieces by viral proteases. This all happens in the cytoplasm of the host cell, since that's where the ribosomes are found, and results in several viral proteins. Coxsackievirus is primarily transmitted from person to person via the fecal-oral route. In other words, you catch it by ingesting stool particles of someone who is sick. Yuck! This can happen if infected stool ends up in the water supply or on agricultural fields, if flies land on it and transfer stool particles to other places, or by touching contaminated surfaces. You can summarize it as the 4 F's: fluid, fields, flies, and fingers. As a result, Coxsackievirus can end up in food and drinking water. It can also be spread by respiratory droplets when someone sneezes or coughs. After it enters the body, the virus first replicates in cells of the pharynx and terminal ileum. From there, the virus enters blood vessels and travels to lymphatic tissue throughout the body. This initial viral presence in the blood is called minor viremia because it's a relatively small amount of virus. All right, Coxsackievirus counts over 24 serotypes, but they can be grouped in only 2 groups, A and B, based on their pathophysiology. Starting with Group A, it most commonly affects children under 5 years, and it generally prefers infecting the skin and mucous membranes. The most known serotype of this group is A16, known to cause the hand-foot-mouth disease, called so because it causes tiny blisters on those body parts. Other concerning serotypes include A25 that causes hemorrhagic conjunctivitis, and A7 that causes polio-like permanent paralysis, though it's rare. On the flip side, Group B prefers going deeper into the body, infecting visceral organs and causing problems like gastroenteritis if it affects the gut, pericarditis in case it infects the pericardium, which is that tough membrane that envelops the heart, or even causing myocarditis, which happens when it infects the heart muscle, resulting in Coxsackievirus-induced cardiomyopathy. Sometimes it travels through the bloodstream and gets into the brain, where it can cause encephalitis when it causes inflammation of brain tissue, or result in aseptic meningitis when there is meningeal inflammation. People with a Coxsackievirus infection present symptoms depending on the infecting Coxsackie group. If it's Group A, people present with symptoms of hand-foot-mouth disease that includes painful oval-shaped blisters on the fingers and palms of the hands and soles of the feet. These blisters may also be present in the mouth, throat, and tonsils in the condition known as herpangina. In the case of hemorrhagic conjunctivitis, people present with itchy, swollen eyes, appearing red due to subconjunctival bleeding. When the infection is due to a Group B Coxsackievirus, it typically causes systemic signs and symptoms, including fever, headache, and extreme fatigue. Other symptoms may vary depending on the affected organs, such as chest pain in case of pericarditis or myocarditis, and diarrhea and vomiting in case of acute gastroenteritis. If it progresses to aseptic meningitis, it typically causes a headache, neck rigidity, and pain. The diagnosis of Coxsackievirus infection is mainly based on symptoms. Laboratory investigations are reserved for severe cases. In the lab, the virus can be identified by using reverse transcriptase polymerase chain reaction, or just RT-PCR, which is a method that consists of identifying its RNA in body fluids or even having viral cultures in viable cells, but this is not routinely done. The treatment of a Coxsackie-virus infection consists of supportive management, like keeping people hydrated when there are minor symptoms. In severe cases, like meningitis and myocarditis, intravenous immunoglobulin, or IVIG, is usually given. Alright, as a quick recap, Coxsackievirus is a positive-sense, single-stranded RNA virus that belongs to the enterovirus genus. It is transmitted from person to person, mainly via the fecal-oral route. Coxsackievirus is divided into two groups, A and B, based on its pathophysiological mechanisms. Group A tends to affect the skin and mucous membranes, mainly in children under 5 years, causing hand-foot-mouth disease, hemorrhagic conjunctivitis, and rarely polio-like permanent paralysis. On the other hand, Group B tends to infect visceral organs, resulting in more severe conditions like gastroenteritis, pericarditis, myocarditis, and even encephalitis and aseptic meningitis when the virus gets into the brain. The diagnosis is basically clinical, but in some cases, reverse transcriptase polymerase chain reaction is used to identify the germ's RNA in the samples. When there are minor symptoms, the management is mainly supportive, making sure that people are well hydrated, while the use of intravenous immunoglobulin is reserved for severe cases like meningitis and myocarditis.
Thanks for watching. If you're interested in a deeper dive on this topic, take a look at osmosis.org, where we have flashcards, questions, and other awesome tools to help you learn medicine.